This is the Disability News Report with host Arthur Aston.
Welcome back to the Disability News Report. I'm your host, Arthur Aston. Let's get into the news. ABLE accounts rules are updated as bigger changes loom. Achieving a Better Life Experience, also known as ABLE accounts, were established under a 2014 federal law of the same name. These accounts offer people with disabilities the opportunity to save up to $100,000 in a savings account. Holding money in an ABLE account does not impact someone's eligibility for Social Security and some other government benefits. Medicaid can be retained no matter how much money is in one of your ABLE accounts. According to a report at the end of June of 2025, there were over 213,000 ABLE accounts that were open with an estimated $2.6 billion in assets. Some of the rules that determine how ABLE accounts were used were set to expire at the end of 2025. These rules, however, were recently made permanent. One of the rules that was recently made permanent is the option for ABLE account holders who are employed the opportunity to save extra money in their accounts if they do not participate in an employer-sponsored retirement plan, as well as the ability for ABLE account holders to roll over funds from a traditional 529 college savings plan into an ABLE account. That provision is designed to help families that set up college savings plans for their child, not knowing if their child has a disability or not. These rules were made permanent by the passing of President Trump's Big Beautiful Bill. To this point, accounts have been limited to those with disabilities that were prior to the age of 26 years old. Starting in January 2026, that age limit is increasing to the age of 46. This will also increase the estimated number of individuals who are eligible to open ABLE accounts from 8 million people to 14 million people. ABLE accounts are something that are very beneficial to those in the disability community, as people with disabilities who receive government assistance like Social Security or disability benefits, they are limited to how much money they can hold in their personal bank accounts before their benefits are impacted. It's so important that everyone keeps looking at how ABLE accounts and their use can be improved for people with disabilities to have access to a savings plan for their future. Our second story is A Place for Us by Us. San Francisco's Disability Cultural Center breaks ground. To begin this story, we actually have to travel back in time a little bit. Let me take you back to April 1977, when more than 100 disabled protesters staged a nearly month-long sit-in at a federal building in San Francisco's United Nations Plaza. Because of the sit-in, the Secretary of Health, Education, and Welfare implemented the long-delayed Section 504 of the Rehabilitation Act of 1973. This law prohibits discrimination based on disability in programs that receive federal financial aid. This sit-in also eventually resulted in the passing of the Americans with Disabilities Act in 1990. Fast forward back to present day 2025. And this story that we are currently talking about tells us about the city of San Francisco and how they opened the country's first disability cultural center, located right across the street from San Francisco City Hall. The center began hosting online events in 2024. And as the online community grew, organizers worked with the city to prepare for the center's physical space opening in the summer of 2025. The space features decor that was created by disabled artists, and the seating is made so that it can be moved around the entire space. The Cultural Center hosts a variety of events, including plant potting classes, a film festival, and dance classes. There are also plans to host job search workshops and peer support groups as well. The center is publicly funded and contracting with nonprofit Haven of Hope for the next 4 years. Disabled writer and activist Alice Wong moved to San Francisco in 1997. Even though this was after the Americans with Disabilities Act was passed, Alice recalls encountering many barriers in the city and on the campus of UCSF, where she was attending graduate school at the time. This included housing on campus that was not accessible for her. She was living in a renovated space that was in the basement of one of the campus buildings because that was the only space that was accessible for her. When asked to share her thoughts about the Disability Cultural Center, Alice said, "Today's political climate and cuts to Medi-Cal, food stamps, and other social safety net programs makes the need for community even greater. We need the DCC more than ever. Disabled people are not okay. We are scared and enraged, and this center will be a place of connection where we can build power and feel less alone." When asked about the cultural center, San Francisco resident Sophie Mai is quoted as saying, "Representation is important also for disabilities that are invisible, and this is a beautiful space." She says that she is looking forward to spending more time at the Disability Cultural Center. With the opening of San Francisco's Disability Cultural Center, other cities have been in contact with the co-director of the center to ask for more information on how disability cultural centers can be opened in their cities. We look forward to sharing more news about the wonderful work going on there in San Francisco with their Disability Cultural Center, and we also hope to hear of other cultural centers popping up around the country as a result of this grand opening in San Francisco. Our next story is titled "Living an Immigrant Life with a Disability." Here on the Disability News Report, we aim to bring you the most recent news stories that impact the disability community. As part of this, we value stories from a first-person perspective from individuals who are living with disabilities. This next story was shared on the American Association of People with Disabilities website. The article is written by Dr. Hugh, who is a visiting research scholar at the Laurie Institute for Disability Policy at Brandeis University and an adjunct lecturer at the University of Maryland, College Park. She published her first book entitled "Inclusion, Exclusion, Agency, and Advocacy: Experiences of Chinese Women with Disabilities with Worldwide Implications." She is also a book series editor for the Palgrave Studies in Disability in Asia and the Pacific. On arriving in the United States, she experienced some setbacks, so she had to pivot from her original plan to pursue her degree right away. These setbacks included having to have surgery and the time needed to recover after the surgery, finding reliable and permanent housing, and also securing a work visa and finding a job. A disabled researcher and advocate, Dr. Hughes says, "Many disabled people plan to live their lives based around their disabilities. As a disabled immigrant, I also plan and live my life based on my immigration status." She goes on to say that as the number of years living in the United States as an immigrant increased for her, she started to feel and think more strongly from an immigrant perspective. Disability has led Dr. Hugh to where she is today, and she says that it has opened a new world and new perspective for her, for which she is deeply grateful. She manages the challenges that come along with living with physical disabilities, and she says that she enjoys her life as a disabled person with access to diverse disability communities. She wears her prosthetic devices visibly, and mostly she doesn't care much about what others think of her. As a disabled woman, she found a partner, got married, and started a family here in the United States. The combination of her multiple intersecting identities of being an immigrant, a disabled person, a Chinese woman, and a mom affects her life in subtle and profound ways. This story highlights the important reminder that many of the immigrant-related experiences, unfortunately, are riddled with challenges and stress, especially when coupled with the fact of living with a disability. We look forward to sharing other first-person perspectives of living with a disability here in the United States and around the world. Our next story comes from the University of New Mexico Hospital, and this story is titled "Providing Accessibility to Patients with Disabilities." For someone with a disability, finding health care and a healthcare provider can be quite difficult. The Community Engagement and Language Access Center at the University of New Mexico Hospital, UNMH, is hoping to help change this a little bit. This facility is led by Executive Director Fabian Armijo, and it focuses on making healthcare more accessible. At UNMH, importance is placed on patient feedback and then making the appropriate adjustments and improvements. As a patient, they recommend that you share what your specific needs are when you are scheduling your appointment. Language interpreting services is something that UNMH prides itself on. ASL interpreters are on call for either in person or by video through UNMH. Wheelchairs and employees available to assist patients with transport are available to all patients. Sensory kits and short videos were developed to help patients with autism navigate their health appointments. These kits include items such as noise-canceling headphones and fidget toys. To assure that accessibility needs are being met, UNMH partners with organizations such as the UNM Center for Development and Disability, the UNM Accessibility Resource Center, and the New Mexico Commission for the Deaf and Hard of Hearing. Hopefully, this is just the start of the bigger movement to increase the type of care that disabled patients receive when they are receiving care at UNMH. And we hope that this will encourage other healthcare facilities in New Mexico and around the country to improve the way they provide care for their disabled patients. Our final story is titled Summer of Disinvestment is a wake-up call for disability advocates. This final story comes from the state of New Mexico and addresses how recent cuts to programs like Medicaid will impact the number of services that are provided to the disabled residents in that state. This summer marked the anniversary of two very important pieces of legislation that impact the disability community. This year marks the 35th anniversary of the Americans with Disabilities Act that was signed into law by President George H.W. Bush, and the 26th anniversary of the Olmstead versus LC decision that established that the unjustified institutionalization of people with disabilities is a form of discrimination that is prohibited by the Americans with Disabilities Act. This ruling requires public entities to provide services to people with disabilities in the most integrated setting appropriate for their needs, such as community-based programs rather than in institutions. These celebrations were unfortunately hit with what some are describing as a dark cloud with the passing of the Big Beautiful Bill. Living Well Disability Services is an organization that began in Minnesota in 1972. Living Well Disability Services provides valuable support for hundreds of people impacted by disabilities every hour of every day for the last 50 years. They serve 300 people in 36 group homes, and through customized in-home services, they have a staff of 500 people and over 500 volunteers. All of the consumers at Living Well Disability Services depend on Medicaid. Reduced Medicaid budgets will have the following impact on their organization. The cuts will limit the development of new services and the ability of housing opportunities. The number of staff available to support the people they serve will also be limited. Hiring and retaining and paying fair wages to support staff will also be impacted by these budget cuts. Here at the Disability News Report, our mission is to keep you informed with stories that matter most to the disability community. From state and federal legislation to local events and initiatives, we'll continue to bring you the news and the perspective that shape our lives. That's all for now. Thank you for tuning in to the Disability News Report. We'll see you next time.
This is the Disability News Report with host Arthur Aston.